Hey you, how's it going? Welcome back to, my channel. Welcome back to TransTalk. It's been a while. And today I'm going to be talking about hormone therapy. The reason why is because I've been on hormones now for over 2 years. I've actually been on hormone therapy for 249 days at the point of recording this video, which I think is pretty cool. But yeah, this video is based on my experiences with hormone replacement therapy, because there are other options available to the ones I'm going to talk about, and I'm specifically going to be talking about the ones that are available to male to female transgender people. I've been taking Everol patches twice weekly, which is an estrogen supplement, so that my body can produce female levels of estrogen, and to combat that, I've also had to take leuprorelin, which on the box says Prostrap 3, every 3 months, which is an anti-androgen, because if you raise the levels of estrogen in your body will naturally produce extra levels of testosterone to counteract it. That can be solved with anti-androgen, which is what they do. It's an injection. It goes into a fatty area. You have to have an appointment with the GP to do it because of the nature of it. But yeah, so let's talk about the do's and don'ts of hormone therapy. Obviously, don't self-medicate with this. It's a very risky procedure. In fact, there are a ton of side effects that just don't do it yourself, is what I'm trying to say. What does hormone replacement therapy do? There is the big one, the one that is going to matter probably the most to trans women, at least from my experience, and that's breast growth. Yes, hormone therapy does induce the growth of breast tissue. It also makes your nipples a lot more sensitive, which, trust me, you'll notice. A few of my friends weren't educated enough on the topic to know that I would grow them naturally. They thought they would just be kind of like done in a boob job, and no, they do actually grow naturally when you're on hormones. Another thing that hormone replacement therapy does is it does make your skin slightly thinner. It also makes it more translucent, which means that like veins become a lot more prominent. For example, that's my wrist at the minute, and that vein section there was definitely not as visible as it is now. It's also a lot more noticeable on the like legs and feet area, I've noticed. It does also reduce the growth and density rate of the body hair. It will obviously grow because females do have body hair. It's a biological fact. It's just not as thick or as dark or as fast growing as most males. There will also be some changes in fat distribution. This was one of the things that kind of confused me at first. You tend to notice a lot more around the hips and the thighs area, basically just to kind of give you like more curves effectively. Like it tends to shift more from the tummy area to the sides, is what I noticed at least. And then there's also a decrease in muscle mass. If you are a particularly muscly guy, you know, you're hitting the gym all the time, pumping iron, that probably won't make much of a difference then. But in most cases, if you aren't regularly working out and stuff, your upper body strength will probably decrease massively. So what won't hormone therapy do that you probably might want it to do? Well, it won't reverse puberty for a start. That's one hell of a misconception. A lot of people think that, oh, it's basically just like turning the clock back. It's not. Sorry about that. I know I've probably just ruined all your dreams, but it doesn't do that. It won't change your height. It won't change the length of your arms, your legs, your feet, your hands. It won't change your facial bone structure. Another thing it won't do is affect your voice. Now, this is something that definitely differs across whether you're male to female or female to male, because testosterone does affect female to male transition voice. I've noticed it in a few of my trans male friends who all sound great. I wish there was the same effect with the male to female transitioning hormones, because that would make my life a hell of a lot easier. Also, it won't affect facial hair. That is something that really... However, facial hair can be removed by lasers and electrolysis in combination, but I've already talked about that topic on another video, a TransTalk video. There will be a link to it. Go and check it out. I think it covered a lot of bases, that video. Also, as with any sort of medication, there are some psychological changes. One of the things that is very common is mood swings. 1 minute you can be really, really happy. The next minute you're just, nah. Yeah. It always happens around the times when I have to have the anti-androgen injection every 3 months. It just kind of like, I hit a low, There's a few days where I'm just kind of like, oh, I really just can't be bothered doing anything. Stay in bed for ages. And yeah, but swings and roundabouts. Mood changes happen with almost all medication. There are also some sexual changes. There will be a drop in your libido. You won't be wanting to do the do every 5 minutes. The whole waking up with morning glory doesn't happen. At least not for me. One final side effect that I'm going to talk about is something that I realised the other day, because I was looking at the long-term side effects for the leuplorelin, and I noticed that with long-term usage of leuplorelin, which is the anti-androgen injection, one of the main side effects is tiredness, like overtiredness, which makes a lot of sense because for the past year I have really struggled to wake up in the mornings. I have had my housemate Chloe waking me up on a nearly daily basis at one point. So yeah, set alarms if you are going to be on leuplorelin for quite a while, which with NHS waiting times you probably are. As with all my TransTalk videos, I gave you guys the opportunity to ask questions. One question that I was asked was, does it hurt? And you know, kind of, to the extent that you're having a needle put in your arm every 3 months, and if you find needles, injections, somewhat painful, yeah, it does kind of hurt. There is a few days of just lingering pain you get with almost any injection, but like this, I do notice this quite a lot. Like sleeping on this side is almost impossible after I've had the injection. On the whole though, it's a relatively painless experience. There's kind of, you know, like growth pains and stuff with the breast growth, but other than that, there's really not much pain to it. It's just kind of like living life. So yeah, that was my TransTalk on hormone replacement therapy. I hope that you've got something from this video if you've clicked on it wanting to either find out more about hormone replacement therapy, or maybe you're about to start undergoing hormone replacement therapy, and if you are, good luck. I recently found out the date of my surgery, which is the 27th of July. I'm probably going to make a video on surgery at some point. If you want to hear more TransTalk videos, comment below. What do you want to know? All of it from my own experience. I can do research if you want beforehand though, just in case it's something that I don't have that much experience in. But yeah, please give this video a thumbs up if you enjoyed it or found it useful, because it does help with the YouTube algorithms. Don't forget to subscribe if you haven't already, because then you will know when my next video comes out. I hope to see you in the next video, whenever that will be. Right, adios, bye.